get to find Theralase? I mean, have you been into laser for a very long time as a
So
doctor?
early on, I was an early adopter of laser and these other technologies that are available to us, like pulse wave therapy. There's different vibration. It's really important, I think, that we look for that customized and personalized therapy that is using, some of the biohacking concepts, these newer concepts, right, for decreasing pain, for improving performance, as well as healthy aging. That's what we want. But with somebody like you, we have to start with the pain model and try to figure out all of the different things that we can do to help enhance you feeling better. So I really do believe that light and sound is the future of medicine, and laser is light.
You are one of the very few, I think you're the only one in Los Angeles who has this machine.
Yeah.
And how come nobody really knows about Theralase?
They're a Canadian company,
Right.
and they haven't had strong representation to market into the States. So when I was doing research for the different companies that have lasers, I had an opportunity to be at one of the big trade shows. I do a lot of teaching to chiropractors, and I met Roger White, who's the owner of Theralase. And Roger and I must have spent a couple hours together, and he really took me through his process of using that technology. And at the time, Theralase was the only one that had cell sensing technology. And what that meant is I could take those pods and I could lay them on your body and I didn't have to move them around. This cell sensing technology that Theralase came up with was putting that applicator over the target area that I need to treat.
Okay.
And through a biofeedback mechanism, it would dose the tissue. It would come up with the dose. And anybody that's worked with lasers for a long time knows that the dose is the most important thing. So this is on and off for fractions of a second. So you might feel a soothing warmth, but it'll never get hot.
Okay.
We don't want a lot of heat from these lasers.
Okay.
Heat's a byproduct that we don't really want. So that was important to me, that I could lay these on, I could actually have the patient also be able to target themselves. If I say to the patient, you're allowed to micromanage me, let's move it a little left, a little right, up or down to help focus to get that light into the specific area that you need it.